Hi, I'm Terry Nava Anderson. I am a birth and postpartum doula trainer. I've been doing that for about a decade. And I've been a birth and postpartum doula for almost 20 years professionally and have been supporting pregnant people since I was a teenager, which is a lot longer than 20 years. It's an honor to welcome a new child into the world and encourage and support people through the process of pregnancy, birth, and postpartum. It's also a really exciting time to participate in your community as a childbirth or postpartum professional. Whether your clients are choosing hospital, birth center, or home birth, or already have a newborn at home, Harmony Doula Mentoring can help you to have the skills you need to provide compassionate, culturally sensitive, emotional, and physical support using evidence-based practices from both new intervention and time-honored tradition. Our community birth and postpartum doula training workshops are designed to build your confidence, knowledge, and skills as a doula, guiding you toward a great start to a successful career as a childbirth professional. The workshop includes childbirth and lactation support education and labor support history, all with a lens of trauma-aware or informed care, racial equity and inequity, intersectionality, and inclusivity. We strive to maintain an affirming and welcoming environment for all birth workers. Further mentoring and valuable hands-on birth experience with a supervising doula are also available for those of you who might be in our service area. Myself and the Harmony Doula team have been committed to training and mentoring community-based doulas to serve members in our own and their own community for over a decade. It's our mission to increase access to doula care for every member of the community and increase knowledge of the unique health disparities facing people who are pregnant in our area, in the California Central Valley in particular, as well as across the globe, thereby leading to greater equity and better birth and postpartum outcomes for all. The complete workshop is an approved doula training for midwifery students at the Midwives College of Utah, and is also approved for birth and postpartum certification and recertification with DONA International. We're an approved provider of contact hours with the California Board of Registered Nursing. If you need contact hours, contact us for more information. In the birth and postpartum doula training workshop, you'll learn the role of a doula as an advocate, working with members of the care provider team, and the benefits of having a birth and postpartum doula as part of that team. We learn about a holistic approach to the years surrounding birth, including nutrition and physical and emotional wellness. We learn strategies and skills for supporting emotional well-being and healthy physical recovery, including practicing trauma-informed care. I am an approved provider of the When Survivors Give Birth training program, which is specifically regarding working with clients who have experienced adverse childhood experiences, particularly sexual trauma. And that is kind of woven throughout the course. We include basic lactation and newborn feeding skills. For those who are doing the postpartum section, that dives deeper into lactation support than those who are just attending for the birth portion. You can attend both birth and postpartum. We learn about critical thinking skills for assessing the research and evidence, and effective communication, active listening, and conflict resolution and advocacy skills. We do touch on basic marketing and business organizational skills, and in particular, how to register as a Medicaid provider. I do know mostly about how to do that in my state, California, but I can help connect you to people in your area if you're in a state that has doula coverage for their Medicaid beneficiaries. In the birth portion, we talk in depth about the anatomy and physiology of labor and the biomechanics of the pelvis, so that we can help our clients understand what they can do before and during labor to help them have a better or easier experience. We talk about the interventions and augmentations that might be available to them, and their associated benefits and risks so that we can center our clients as the decision maker on their care team, understanding that they have choices and options and how to ask about those with their care team. We talk about the theory of pain perception and potential consequences of things like fear in labor for our clients. In class, we'll work on developing physical and emotional toolkit strategies for improving the hormonal cocktail of labor, for using pelvic floor release and movement to open the pelvis and help optimize space for baby, to reduce fear and anxiety and increase comfort and coping skills for our clients. This might include things like massage, body work, positioning, movement, acupressure, utilizing a TENS unit, or sometimes knowing about the safety and use of herbs or aromatherapy, and what is in your standard of practice as a doula and what might need to be referred out to another professional. We discuss the culturally and ethical responsible use of some tools like a rebozo, which is a cloth that might be used to help facilitate comfort and movement in labor. In the postpartum doula portion, we go in depth on perinatal mood and anxiety disorders and how to help your client reduce their risk for experiencing those. We'll talk about healthy sleep practices and newborn care in order to help set up our clients for success in early parenting. And most importantly, in the postpartum doula section, we talk about the differences between the different professionals who might work in the postpartum space and how a postpartum doula is different than a newborn care specialist or a nanny, to help your client understand the differences and what your unique skill set and the benefits of having a postpartum doula are. If you're planning to continue on with certification through DONA International, you'll need to turn in some paperwork with DONA, more specifically some evidence that you've done some additional reading. DONA provides you with a choice of books to add to your knowledge toolkit. You'll write just a few sentences on what your key takeaways were for those books. You'll also need to fill out a short questionnaire that is core competencies. I don't want to call it a quiz because it's just a questionnaire. And if your reviewer has questions about your responses to that, they might get in touch. You'll also need to work with 3 clients. For birth doulas, you'll need to support 3 people continuously through their active labor, and we talk about how to identify that in class, through to their delivery, and then have your client provide an evaluation of you, as well as an additional observer. That could be their partner or the care provider, who could just attest that you were there and that you provided support to the client. If you're planning to certify as a postpartum doula, you'll also need to support 3 clients. Each of those clients will need to receive at least 12 hours of support from you over a minimum of 3 visits. Baby needs to be less than 12 weeks of age when that happens, and you'll also be turning in paperwork regarding your support of that client. It's a relatively simple process, and we at Harmony Doula provide office hours every single month, every first Tuesday of the month at 6 p.m. Pacific time, for our students to help you get through that paperwork and become more confident as a perinatal postpartum professional. I hope you decide to sign up for the class, and I look forward to meeting you.